Hey, good afternoon. Dr. Ken Starr with the Wellness Group in Arroyo Grande, California. I want to talk to you about the 4 ways you can use buprenorphine or Suboxone to get off of fentanyl. Watch this whole thing to the end. At the very end, I'm going to give you the exact recipe I use here at the Addiction Medicine Program or the Wellness Center here on the Central Coast of California, where we do this all day, every day. And there's a lot of misconceptions about fentanyl, how problematic that is, how challenging it is for these patients. And so we want to do everything we can to get them off of fentanyl, at least temporarily onto bup and then, or Suboxone, and then taper them off. Number 1, there's the traditional way. So before fentanyl came along, when people were just on pain pills or heroin, if you remember, we'd say, hey, go into withdrawal, wait as long as you can. Here's meds that will assist with withdrawal, help you kind of calm down, get you to that 48 hours, 72 hours, and then you're going to start low doses of Suboxone. 2 milligrams, take 2 milligrams, take 4 milligrams, wait a few hours, take another 4 milligrams. Hey, wait a few hours, take another 4. Maybe your doses are 16 milligrams that first day. That was fine for traditional opiates. It doesn't work with fentanyl, and here's why. Although fentanyl is a very short-acting opiate, it's one of the shortest ones we have. If you use it regularly, it builds up in fatty tissues, called being lipophilic, and the withdrawal period is prolonged. It just sort of leaks out of your system very slowly and has detox or withdrawal characteristics more like methadone, where it's days and days and days. So if you tell someone, hey, wait 3 or 4 days before you take Suboxone, they're super sick, precipitated withdrawal. They do everything you told them to do and it doesn't work. So traditional induction doesn't work with fentanyl, okay? That's the first thing that you need to know or your provider needs to know. If they say, hey, just wait a few days, start a low dose, just don't do it. It's not gonna work. Number 2, microdosing. I had a video earlier on microdosing. Microdosing is this. For the next week, keep using what you normally use. No difference. Don't change anything. You don't have to stop using or go into withdrawal. You're going to start adding little doses of buprenorphine every day in increasing amounts. 1/4 milligram twice a day, 1/2 milligram twice a day, 1 milligram twice a day. And as it gradually ekes up, it's never enough to kind of pivot and throw you into precipitated withdrawal. You're just kind of dusting those receptors, shoveling a little more on them, just a little bit every day while you're using. By day 7, you can transition off and just transition on to Suboxone. There's 10-day programs, there's 10 days of recipes I've seen, there's 14-day recipes, that's all fine. Pick one you like. I use one that's 7 days, it seems to work fine. I don't like to do longer because I'm telling people, hey, continue using fentanyl, and I don't want to overdose and die. So I was like, you know, it's not a great program for that because it incurs more risk, but at least people are more successful because you never have to tell them to stop and go into withdrawal, which is not good. The third method is macrodosing. Again, I had a previous video, please watch, it's on microdosing and macrodosing. Macrodosing is kind of like the traditional model where you say, hey, wait, you got to go into withdrawal, wait as long as you can. Here's medicines that can help calm that storm. Maybe you give some Valium or hydroxyzine or tizanidine or clonidine or Lucimera or something and get them to that 48 hour mark. Now you come in with big doses of buprenorphine, 16 milligrams, 8 milligrams every hour. 8 milligrams every hour, and you just keep going. That first day you might use 60, 70, 80, 90 milligrams of Suboxone, or buprenorphine to be more precise, because it comes in, it pushes off that receptor, it pushes all the fentanyl off that receptor, and it saturates it. And it has to be enough of a dose that's going to compete at that site and push all the fentanyl away. So that first dose may cause a little bit of precipitated withdrawal, but again, you're coming in every hour with just a bigger dose, so it doesn't last very long. It's called macrodosing, it's big doses. These are higher doses than you're going to use in a maintenance program, you know, which typically peak out about 24 milligrams a day. So you might be on a high dose that first day or even that second day. By day 3, we can get them down to 24, and then we can go down from there as quickly as they tolerate it. The last way is more kind of not exactly legal, but people do it. And if you have to, you have to, using full agonist opiates like oxycodone to bridge people. In other words, someone's using fentanyl, you can't start them on subs because of this whole issue being lipophilic. So say, okay, here's 3 days, here's 4 days of oxycodone, 30 milligrams, 3 times a day, 4 times a day. Prescription from a pharmacy. They're taking that for, say, 3-4 days for pain. Fentanyl's coming out of their system, it's diving down low. You stop the oxy, you wait your 12-24 hours, boom, you can glide onto Suboxone from there, and that's pretty smooth too, because you want really a smooth, successful transition. We're not going to talk in this video about Suboxone and the risks and benefits of that. I just want to explain the 4 steps or the 4 techniques you can use. So pick one that you are most comfortable with, that you think you can, get through, and stick to it. Okay, I'm going to show you now my specific recipes I use. This one here is called microdosing. This is my 7-day protocol. You'll see that it's 7 days. On day 7, you're off of your regular opiate. You're just on the buprenorphine. That last day, it used to be 12 milligrams a day, but I've actually increased it over the last few months to 24 milligrams a day. That's a lot of 2 milligram strips you're taking that day, but you got to get there. That's my microdosing. There's other strategies for a 10-day, for 14-day. I've seen the recipes, they're fine, they work good too. Next, here's a macrodosing recipe where you're just 8 milligrams every hour. And it's really just that simple. Just wait as long as you can, have some degree of withdrawal, a high COW score, clinical opiate withdrawal score, and then coming 8 milligrams. I would start with 16 and just do 8 milligrams every hour. Now, if you start feeling okay, you stop, you're done. Okay, that's called macrodosing. Thank you for your time. I appreciate it. Please like, please subscribe. Let me know what questions you have, and we'll do a video on just readers' and viewers' questions.